Good morning, everybody. My name is Andrew Rodman with Western Marketing. First and foremost, I want to thank Courtney Stowe and DeAndrea Searight that they took time out of their day today to help us with this webinar training on dual special needs products. In the Medicare Advantage space, now is one of the best times to get into the market. We've got some exciting things to kind of go over for you guys, some basic information with you guys, built in with and partnering with Humana to deliver that message for you guys. So before we get started, I did want to just mention that if you guys do have questions throughout this presentation, there is a chat box at the bottom right-hand corner of your screen. Go ahead and type your messages in there, our questions, and we might answer them as we go, or we will just kind of wait until the end. That's there. So we will get a recording out of this webinar as well as the deck pages to this as well, so that you can use it for later viewing at this time. If you've got your cell phone handy, you got that ready, just go ahead and take a picture of the screen, or you can see the QR code. What that is going to do is bring you to a contact page to Western Marketing. Just kind of, general inquiry. If you're not already set up with us or want to learn a little bit more about who we are and what we do, that's there and available to you. Courtney, if you want to go ahead and go to the next slide here. One of the things that I wanted to talk a little bit about what we do here at Western Marketing is, try to just help agents in any way that we possibly can. Support is key for you independent producers, agency owners that are out there to help, whether it's simple processing of contracts, processing of business, trying to help grow your business and the technology that you need to grow your business. We're here for you. The integration that we have, we recently integrated with Integrity Marketing Group, has been fantastic in my eyes. We've had a lot of different tech tools, relationship things that have just really made my job easy to better serve you as the independent agent or agency owner. So we're here for you. A part of that integration is, integrating with Humana. Courtney and I have known each other for quite a while. We love working with Humana. Love working with Courtney. Their team over there has been great. I can tell you there's not many people that I can text and get a response right away, and Courtney's one of them. So I really appreciate that. Let's go on the next slide, Courtney. One of the tech and tools that you guys may or may not know, you've probably heard of it through some of the insurance forums and things like that, but through Integrity, we do have a single sign-on platform for insurance agents that are experienced or new to the market, whatever it may be, but it is a single sign-on platform where we're able to do quoting, enrollment, tracking of your clients, and most importantly, that new requirement, if we're doing any kind of telephonic sales, is the call recording. It's a complete system that is CMS compliant. We won't go over that today, but it is different training that we do for you guys. It's a great resource, and it's right at your fingertips when you're connected to Western Marketing and an Integrity partner. One other nice thing is that you actually get a personal website when you go through that Medicare Center also. So if you don't have a website, it's literally a no-cost website that is a very informational source for people to actually find who you are, what you do, and some embedded enrollment links as well. So it's kind of intuitive for you as well. Courtney, the next slide, please. Lead center. Everybody kind of wants leads. Where do we go? Integrity has developed a lead center platform. I can tell you that when we first were introduced to this, it was mainly life term final expense focused, but they're shifting gears quite a bit towards the Medicare market. So I would see more Medicare and health related products that are available to you. There's real-time leads, there's aged leads, different types of social media, direct mail, that are all there right at your fingertips, should you need to get in front of more clientele. When I send this out in the recording that's there's actually a discount that's going on right now. I think it's 30 or 40% off your lead order on specific type of leads. So, another opportunity for you to be able to get in front of more clients right at your fingertips. So that's just a little bit of the few things that we can do here for you at Western Marketing. I'd really like to hand it off to Courtney and DeAndrea. They're our main guest speakers here today with Humana. Like I said, they've been great partners. DeAndrea, I met you at the Humana rollout in Omaha, Nebraska, and I told Courtney I was blown away by her presence and her sheer passion for working in the dual special needs place. So I told Courtney, I said, we need to, first of the year, get DeAndrea on a call, get her on a webinar training, try to get her in front of as many people as we possibly can, because she's fantastic and that passion just pours out. So without further ado, Courtney, DeAndrea, please take it away.
Thank you so much, Andrew. Firstly, for having us on with you today. It's always a privilege, as you said, to work together. I always enjoy working with Western Marketing and the way that you support your agents too. I definitely feel that out there when I'm working with agents across the Midwest. So today we have a lot to talk about, but thankfully, if you are new to space, this presentation is for you. While sometimes we may get very acronym driven and throw a bunch of letter alphabet soup at everyone, we want you to really feel like you are going to be able to understand what those mean and feel confident if you sit down with somebody and they say, oh, I have Medicaid, that you know what to do next. So here's the agenda of what we'll cover. This is zoomed out. This will be high level. If you have weedy questions, please, by all means, throw those in the chat. We're more than happy to answer. But our goal for this presentation is that introduction into Medicaid, who is qualified for Medicaid. Maybe they have never applied, so they don't know if they qualify. This is a spot where agents can be incredibly useful. We'll talk about that. The different enrollment periods, this is a huge factor for us outside of AEP in being able to continue to grow our books of business. And then what does dual SNPs or DSNP, well, what does it stand for firstly? And then what does it do for our members? Why you should really understand the DSNPs available in your area. If we see questions throughout, Andrew, please don't hesitate to stop me if you think that there's something we want to cover during the presentation. Otherwise, we'll be sure to cover them at the end. So today you have myself. Sorry, go ahead.
No, I just said sounds good.
Perfect. I am Courtney Stowe. I'm the broker manager. I have Illinois, Iowa, South Dakota, and Nebraska, so up here in the Midwest. If you are not in that area, that is totally fine. I am more than happy to take questions separately, but I would recommend funneling those questions through Western Marketing because they definitely have my contact information, and it's a good learning opportunity for all of us. So if you have questions, send those over to Andrew personally. Text him on his personal cell phone. He loves that, especially when it's after 5. Just kidding.
Of course.
We also have DeAndrea Searight on the call, and you did an excellent lead up, Andrew, for DeAndrea. That was my first time seeing you present, DeAndrea. It was in Omaha, and I was like, well, dang, I gotta step my game up. So definitely happy to have somebody with this much experience in the room to talk about dual special needs. So without further ado, I'm going to kick it over to you, DeAndrea, to cover our next section of the presentation.
I'm just laughing. If I needed some validation this morning, Andrew and Courtney, you all have made me smile. So thank you both for the compliments. Thank you. So let's do a quick DSNP overview. Some of this stuff may come as a surprise. Some of it may be like, you know, I already know that. But let me give you a history lesson really quick. Go ahead to the next slide, Courtney. All right. So if you didn't know, Medicaid was established in 1965, decades and decades ago. It is made for adults, children, pregnant women, elderly women, and people with disabilities. And when you find out when you're working with DSNP, we're only going to be focusing on the elderly and the people with disabilities. It comes with partial and full benefits. As for the mandatory and optional benefits, that comes to a state level type thing. You'll see that some states have some of the same benefits, and then some of them have separate ones. Those optional benefits includes like drugs, physical therapy, eyeglass, and dental care. So you'll see those, and you can delve into it. The states really have a great website where you can look and see where those benefits are for each member. 76.5 million people are eligible, and then 12.2 million are eligible for enrollment in Medicare and Medicaid. That's our population, everybody. Those that are eligible for both. Courtney, go ahead and go to the next slide. All right, so let's look at Medicare versus Medicaid and what they offer. So we know for Medicare, it is 60. You got to be 65 or plus, or disabled, and you have met the 24-month qualifying period. So for disabled people, they don't just automatically get on Medicare. They have to wait 2 months in order for them to qualify for Medicare. The federal government administers Medicare. It originally covers Part A and then Part B, and then C, Medicare Advantage, and then D, that's that prescription drug coverage. And there's penalties with that if they don't enroll. The cost, what it costs. So for Medicare, there's a monthly premium. Then they have deductibles, and then they have co-insurance. And then just a history, a tidbit, over 62.4 million people are eligible. So then let's switch over to Medicaid. It covers, again, people of low income, families and children, pregnant women, elderly adults, and people with disability. It is administered on a federal and individual state governments. And so it covers hospital, medical, and long-term care insurance, and then you'll have prescription coverage, dental, feet. We need our feet looked at, chiropractic, and personal care. And then those premium amounts that we're so used to saying is little to nothing that they'll pay for Medicaid. So let's go to the next slide, Courtney. All right, so let's see how it combines together. So we know that for DSNP, it's just enhancing their Medicaid. And so it is administered by a private Medicare Advantage insurance carrier, Humana, right? And we enhance those benefits that Medicaid already offers. So just to keep in mind when it comes to that, when they have both Medicare and Medicaid, they still have their Medicaid benefits. So it does not go away once they enroll into DSNP. We're an enhancer. So beneficiaries may not automatically be enrolled in Medicaid based on their situation. So automatic enrollment, they're already getting another type of assistance from the state, like their SNAP, their EBT. And then they're already enrolled in Medicaid and then become Medicare eligible. Those, again, let's talk about those with disabilities. So they can already have Medicaid because of their low income, but now they qualified for disability. So now they have that 2-year waiting period. Once they get that 2-year waiting period, they have Medicare. Let's go DSNP automatically. Let's go. What is not considered automatic enrollment into Medicaid is enrolled in Medicare first and then become Medicare eligible, but not aware if they qualify. You see a lot of that with SSI people. We can get into more delving sessions for that, but that is going to be one of those things where they don't know. And who do we direct them to? Social Security. So the lowdown for low income subsidy, Medicaid low income subsidy, the LIS is what you'll hear that referred to, or that extra help eligibility. But LIS extra help does not automatically qualify them for Medicaid eligibility. So be mindful of that.
I did want to pause here and drill down a little bit on the not automatic section. So I was an agent, a field agent myself, and would sit down with people, and we'll talk about this in a moment, but I would ask them, hey, pull out all the cards you have, or do you know if you have Medicaid? You can kind of ask that in a gentle way that isn't going to be offensive. so much of the time people didn't know. I'll tell you one story about one of my clients who he was telling me he had $600 a month in income, and he was also a veteran, and he had never applied for VA benefits, and he had never applied for Medicaid, both of which he would have easily qualified for, but he just didn't know. That is an area that you as agents can make such a tremendous impact in people's lives, is because those non-automatic benefits are not obvious to everyone. And there's so many people that would qualify for either VA healthcare or Medicaid that have never taken that step to apply. So as DeAndrea mentioned, if you're talking about applying for Medicaid, you are going to go to the state DHS office. And if you don't think that they qualify for that level of Medicaid, but they're still needing help with their drugs, which I believe the next slide will speak to the levels, you would need to have them go to the Social Security office to apply for LIS. Now, the good news is, if you have somebody apply for Medicaid at their state DHS office, they will send that application over to Social Security. So it's kind of a two birds, one stone situation. If they get back from Social Security or from the DHS office that they do not qualify for Medicaid, then you can refer them to the Social Security office to apply for LIS or extra help, which will help them cover the cost of medications. So please ask questions there. I know that's very confusing, that you've got to go to two different spots, and that there's both Medicaid that's run by the state and extra help that's run by the federal government. That's an area that trips up agents a lot. So ask the questions you have, and I will kick it back over to cover the next slide.
Thank you so much, Courtney, for that information. Is definitely needed and understood as we get in the field. And so another thing that we have to talk about is the Medicare eligibility levels, and what qualifies a person for or what puts them into that. And I want to give a disclaimer. Humana does not put the members in these particular categories, whether it's Slim B, QMB, fully FBDE, which is fully full benefits for dual eligible. We do not, the state actually sort these members out, I should not say that. They actually put them into these levels based off of their incomes. And so we see that on the screen, and we don't have to go into deeper details what qualifies a member for QMB. We see where their income has to be, and where their asset limits are for their, single household or as a couple. And so there are qualification guidelines for the different states that, okay, if you're QMB, yes, you are DSNP eligible. You get tricky when you get Slim B or Slim B plus. But again, Humana does not put them into these levels. We just get the information from the state. They say if they're QMB plus, and then it tells us if they qualify for a DSNP. And so I'll let this sit on the screen for a little bit so you can look at those income levels and just know that this is not, this is nothing that Humana puts the member into. The state automatically sends this over to us.
That's a great point. And I'm glad you said that, because that's easy to have it as a misconception that we decide where they go. And you're absolutely right, we don't. So if you're sitting down and having that conversation with somebody, and the good news is here too, agents, as an agent, you don't determine whether somebody qualifies or not. This is really a guideline. So I wouldn't necessarily print this out and take this to your appointments, because it's not up to us to decide whether somebody should or shouldn't apply. This is a guideline to help you understand where those qualification levels are, so that if somebody says, I only make $1,000 a month, you might have a good idea that they are going to qualify for QMB, or maybe even FBDE, which is full benefit dual eligible. I mentioned at the top of the hour, a lot of alphabet soup in you when it comes to dual special needs plans. This is what I meant. this will just help you understand when you should pursue that Medicaid application, or if you think, if somebody says, I make $2,000 a month, well, they're likely not going to qualify, so you can move forward with the conversation. So this is a guideline. These numbers came from the Medicare website, and they update them annually. So these numbers are good for right now, but not necessarily into the future. Andrew, are there any questions or anything that you wanted to hit on before we move to the next part?
No, there's not any questions that I foresee right now, but yeah, I mean, I would like to reiterate, what DeAndrea and Courtney were saying. These are guidelines for you guys to kind of, follow. It is up to, it's not in Humana's hands whether they qualify for that or not. You as the agent don't need to go and make sure that they can qualify for these. They're going to be where they are and determined on that, and we'll be able to figure out which enrollments we need to do and which plans they can qualify for. So very good so far.
Perfect. Something that typically gets asked a lot is, and as we move into the next section is, okay, great, I see that my person might qualify. We go through the application process, but how do I know which levels that DSNP will cover? So firstly, let's talk about how to have that conversation, making sure that we are relaying to our lower income members that their eligibility could change. They may have Medicaid today, but then they might get a raise or have an inheritance. I've seen it happen, and then suddenly they won't have it anymore. So this is a continued conversation that doesn't necessarily just happen the one time. Something too, the next step that we'll talk about is, okay, somebody has Medicaid. They say they do, or in some states, the state has managed care organizations called MCOs, managed care organizations, where a private company is the one who administers Medicaid. So that's true in Iowa. There are a couple different companies where they might pull out their Medicare card and pull out a managed care organization card. And that means you can still write them, but it's just that each state has different guidelines, and it's really important to understand in your individual state. And then from there, seeing that they have an MCO card or a state Medicaid card, you do need their permission to determine if they are eligible for a DSNP. So the talk tracks on the screen are good to kind of keep in the back of your mind, because this can be a very delicate conversation. Asking somebody about their income can be very uncomfortable. And for me, my clients told me everything about their entire life, so it wasn't too big of a deal, but sometimes people can feel very embarrassed by the conversation. So just ask if you have their permission to look up their Medicaid status to determine if they're eligible. So where do you do that? Firstly, the easiest place to go is log into your Vantage portal. That's your Humana agent portal. And there is a DSNP eligibility verification tool. So you can verify both Medicare eligibility and their DSNP eligibility. There's a couple pieces of information that you'll need to enter here, and it will tell you if they qualify for the DSNP that is available in their county. So it won't say generally blanket statement, yes, they qualify for any DSNP, because each dual special needs plan in every area has only certain levels that they will accept. So that's going to tell you if they qualify or not. If your computer died, or you can't remember your password to Vantage, or maybe it's just not going to work out that you're going to be able to verify online, or if you're in, I believe, the state of North Carolina, is that true, DeAndrea? Throwing you on the spot there, sorry.
That is true.
Okay, thank you. So there is one state that this tool won't work, and then you would call into agent support, and that number is on the screen. So I would save that in your cell phone, just in case you ever need to call agent support. That way you don't have to try to hunt it up while you're in the field or talking to a client. You just have that number handy. But of course, you can always go to your local broker manager, Western Marketing, but definitely have that number handy in case you are sitting down with somebody and you cannot verify online. I'm a big fan of online whenever possible. So because we have a wide audience, I'm not being specific into where you can find dual special needs plans, just state specific. So you can see there are some states where they don't have them. Illinois is a fantastic example of a state that does not allow dual special needs plans. They just don't let any company do it. We've asked, trust me, but they won't. So any of these states that are gray just don't have any DSNP available. Now, just because somebody is dual eligible doesn't mean they have to go with a DSNP. They can get any plan that could suit their needs. And depending on their level of Medicaid, and this is a future webinar conversation, whether or not that would work out for them, I'm happy to talk about that in our next conversation. But just generally speaking, this is the states that you can find DSNP. Now,
Courtney, real quick,
sure.
Before you move on, just had a quick question that came through, actually through a text from here. If Humana doesn't have a plan, let's say in Iowa in a specific county, can they still use that verification tool or the hotline to see if they're eligible, although Humana might not have a DSNP in that county?
The verification tool won't work if they're not in a county that has DSNP. They can still call into ASU and they should be able to tell them their level, and that should work to call in. But I would say this is true too. If somebody doesn't have DSNP available, and they're usually pretty good about telling you if they have to pay when they go to the doctor. So it's not a requirement to verify their level of Medicaid if there is no dual special needs plan available in their county. So for example, prior to having a DSNP in Iowa, when I was an agent, I wrote all my dual clients on our zero premium plan that had the best extra benefits. So I don't have to verify because we're giving them the most that we can. And if they don't have to pay copays at the doctor anyway, they still won't when I put them on our zero premium PPO with $3,500 in dental and all of that. So street plan is sometimes the answer when DSNP isn't available. So you don't have to verify. That was a long answer to say it's not a requirement.
Perfect. Thanks, Courtney.
All right. Let's talk about when you can make these changes. And that's why this conversation is so important. There are a couple different election windows as it pertains to dual special needs population. So the first one, and I'll tell you the codes here in just a second. Special election periods for somebody who is currently dual eligible. So they're actively today dual eligible. Quarterly, January through September. So the first 3 quarters of the year, each quarter, so let's say Q1, January, February, March, you can use the SEP to change them to a new plan. Now, let's say you write them this month and next month they're like, just kidding, I want to go back. They won't be able to do that because they've already used their special election window for this month or this quarter. But let's say you do it in March, they signed the application in March and April comes around and they're like, just kidding, I want to go back. You can do it now because it is in Q2. So once per calendar quarter. If they have a change in status, that's different now. So if they're just actively dual eligible, no change in status, it's once per calendar quarter. If they gain, lose, or have a change in level of their Medicaid status, they have a one-time change that lasts the 3 months after the change. So that's not tied to the calendar like the other one is. It is specific to when that change happened. So there are plenty of other election windows. We're currently in OEP. I'm not going to focus on those. I'm just staying specific to DSNP. And you absolutely can market to dual SNPs. So we can't really market OEP. You're not going to be able to hang up a flyer that says, hey, it's open enrollment period. Let's go change your plan. That's not compliant. But you can say, do you have these 2 cards? Do you have a Medicaid card? Then you can go ahead and market to them. So year-round selling opportunity. Let's look at the first one. Well, the left-hand side of the screen is the first one I was referencing. So this is the SEP for somebody who's actively dual eligible. As I mentioned, once per quarter. You can see the quarters on the screen. It's based on when they sign it, not necessarily when it goes into effect. They can enroll, they can disenroll, or change plans, and you're going to use SEP MDE. You can see that on the bottom left of the screen. So you'll want to make sure you have that written down because that's the one you'll use if somebody does not have a change in status. When you go over to the right-hand side of the screen, now this is for people who have had a change. Maybe they just got Medicaid for the first time, or they had full benefit dual eligible FBDE, and they just got a letter saying they're moved to QMB. That gives them the ability to make a change. Again, they can enroll, disenroll, or switch plans, and they can do it within 3 months of that change. They can also just enroll in any Medicare Advantage plan. It doesn't have to be DSNP. They can enroll in a standalone prescription drug plan if that's what makes sense. I have seen a few people lose Medicaid because they had a different change in their income, and then they decide they want to go through underwriting with a MedSup and add a drug plan, and you could do that. I will say if you're a MedSup focused agent, just know you cannot write somebody with Medicaid into a supplement. It's not compliant. The election code is MCD for that change in status. So again, I recommend writing these down, and I will send over to Andrew our SEP job aid, because I don't expect you to know everything or know all of these different letters all the time. We have plenty of resource material to utilize, so we don't have to take a guess while we're out in the field. Summarizing, just a nice, beautiful look at the different opportunities out there. Q1, as we're in right now, we have the OEP and the quarterly SEP for dual eligibles. There's always a 5-star SEP. We don't have any 5-star plans in Iowa, but I know many of other spots certainly do have 5-star plans, and that's a whole different conversation. Q2 and 3, we still have the quarterly SEP for dual eligibles. But what happens if we're in Q4 and you meet somebody who is dual eligible and they need a plan? You would use the AEP. If, however, we're in Q4 and somebody has a change in status, they're newly eligible for a DSNP and they want to get it so it's effective November 1st and get that really awesome healthy options card, they can use SEP MCD to enroll in the Q4. So there is still opportunity in AEP to write dual eligible population. Why you should do it. So this is an area of focus for me when I was an agent. So when I was a sales agent myself, outside of AEP, I focused a very healthy portion of my attention working with the low income population for a number of reasons. One, I like commission and I like growing my book of business. I liked having more income. That makes a lot of sense. It doesn't take any extra steps for you to be able to sell DSNP with Humana than any other plan. If you're contracted and licensed to sell any of our Medicare Advantage plans, then you're good to go for DSNPs, and it pays the same commissions. As DeAndrea talked about earlier in the presentation, there are so many people who are dual eligible. 12.3 million people out there, and only about 25% of them are currently enrolled in a DSNP. So that's 75%. You do the math. I'm not going to do it. That's not my skill set. 75% of 12.3 million people are eligible for a DSNP and are not in one today. That's crazy. I already mentioned year-round selling. The most important one for me, I know I said all of the, the ones that are usually work really well in getting people to consider, but the one on the right is the one that can be the most rewarding. Is you can make significant changes in the lives of your DSNP members. Tell you a story. I got a ton of them. One of my clients, her name is Cora. She was dual eligible. She still is, but she's dual eligible, diabetic. So she lives in a low income high rise. She only gets about $50 a month to live on. So they take all of the rest of her income to pay for her living situation. So that includes medications, if she wants to go do anything, buying Christmas presents for her grandkids, anything. This made such a difference because our DSNPs that don't have to pay anything for medications, so she's saving a ton of money on medications. There's also extra benefits, which I'll talk about in a moment, that can save her money in other areas too, to help her be able to focus that $50 where she really needs it and not on things that are taking care of her health. So that changed her life dramatically. I was presenting to an audience in that low income high rise about a silly topic. And one of my DSNP clients walked into the room, told me to stop, and said she saved me $80 a month on my medication because I put him in a DSNP plan, and he walked away. So you can probably guess how many people wanted to talk to me and how many sales I made because he was able to save some money. This is a group of people that if you help them, they're going to tell everybody, and they want you to help their friends. They want you to help all of the people they know. So excellent for referrals, and you can really help and change their lives. My client Cora also was able to get off injectable insulin because of her engagement in our program Go 365, but that is probably a story for another day. Okay. General speaking again, because our audience could be national. Our DSNP plans have. Sure.
Hey, sorry to interrupt you there. If you go back to that slide, I'd like to kind of touch base on maybe one more thing that you need to maybe look at adding into this too. We'll have probably another speaker on here and some of the webinars that we're going to continue to go into the DSNPs, but her name is Jane Klein here out of the state of Iowa. And another section is referrals. Whether you're a life agent or if you're a Medicare agent that's out there, it's harder and harder to get in front of new prospects. Whether you're doing lead mailers, whether you're doing social media stuff, seminars and things like that. But this DSNP market, we've got some people that, when they go into these households and they make that difference, that last slide, the referrals start pouring in, like Courtney said. Her clients save $84 a month just on her medications, let alone all that other stuff in there. So the ability and the amount of referrals that agents get off of helping this untapped resource, this untapped community is exponential. Because you really are making a difference in their lives. Some people, 30, 40, 50, $60 a month is nothing to them. They spend that on a dinner or coffee in a week, type of thing. But that really makes a difference, and those referrals are definitely coming in. So just my 2 cents in there. Like I said, we'll have another speaker come on probably in one of our later DSNP webinars that we'll do in the next month or two. So
awesome. And I think the world of Jane, and she has such a great depth of experience in this field as well. So looking forward to everybody getting to hear from Jane as well. Okay. General speak here. So I'm not specific to any plan, but they all have dental. They all have no copays for drug. And I'm speaking about Humana. I can't speak for other carriers, but no copays for any of the drugs that are on the formulary. So that doesn't include Puerto Rico. So if you are in Puerto Rico, my apologies, that does not reference those. They have allowances. So I mentioned earlier the Healthy Options card. That is such an incredible benefit for 2023. It can pay for food. It can help pay for rent, mortgage, utilities. You can buy medication, their OTC balances, all of those things. It's an incredible benefit added on that can help people buy things that they maybe otherwise wouldn't be able to, like vitamins. Care coordination, this is huge. Somebody who's dual eligible may have access problems getting to the doctors. Maybe they're going to put off getting care because of transportation issues. Care coordination is as a care manager. It's a social worker, a nurse practitioner, a nurse, somebody who's going to reach out to our members to help make sure that they're going and getting those preventive visits done and that they are able to access the transportation benefit. They're going to make sure that they're staying on top of the things that they otherwise may have avoided because of access problems in the past. Vision and hearing are also included, and all of our Medicare Advantage plans have silver sneakers built in. So that is, I think most of you probably understand silver sneakers, but if not, please reach out. Happy to cover it. That is everything that we have. I'm going to kick it back to Andrew here in just a second. So thank you all for hearing us out in that high-level overview of dual eligible special needs plans. I would ask that you consider working in this space. Something you may hear if you're out talking to other agents is that this population is tough because there's so many people going after it. I would say, I would counter that and say, yes, there are lots of people who love to take advantage of the election windows, but there's a serious lack of agents who really engage with these communities, who actually really want to help these people engage with their program, use the benefits in it, get signed up at a gym with silver sneakers and do all of those things. And if you're that person, you will see so much more success with your membership. They're not going to turn around and leave you because some other person tries to use that election window. They're going to stick with you for life. I have some clients who still call me and I haven't sold a policy in 5 years because I helped them. So if you're that person, you're going to do very, very well in this space. So I'll take it back to you, Andrew.
Perfect, Courtney. I appreciate that. This is one of a couple different webinars that we're going to do. I talked to Courtney and DeAndrea, and we're going to try to do this for the next, 2, 3, 4 months that's here, because this is the time right now to start learning about Medicare Advantage, dual special needs, just that market that's there. So we're going to kind of do a build up process. This is fairly low level, or high level that's there. Overview of dual special needs. We'll have a more in-depth training here next month with DeAndrea and going more in-depth into those plans that's there for you guys that maybe have been in the market for a little more or a little longer, or that want to learn more. So we're not just done here today. Whoever was on this webinar registered, we're going to send out a link to that next one coming up here as well, so you can get registered. Like I said before, if you want to learn a little bit more about Western Marketing, who we are, what we do, there's the phone number right there, the 800-852-7152. I will give out my cell phone just because I give it out to everybody. So that's 712-898-0074. Like Courtney said, I don't mind late night calls after 5 because you guys are working with your clients. If I can't get to you, that's usually because I'm with my wife or my 3 daughters, but I will get back to you and make sure you're taken care of. You can scan the QR code. That'll bring you right to our contact us page at Western Marketing. A couple of questions that's kind of more directed towards Western Marketing and how we, get set up. It's just, how do we get contracted? How do we get set up with Humana? How do we get those resources? That'll come out to an email for you guys that are on the webinar. Those who are not, same thing, that QR code, scan that. There's a tab where you can click on contracting. You can request me or any other marketer that's here to help you out to get you up and going. DeAndrea, Courtney, I appreciate your time today and look forward to trying to get more people in the space of Medicare Advantage and more specifically into the SNP market. So if you guys got any questions, please reach out. Courtney and DeAndrea, thank you very much for your time today.
Thank you.
Thank you.
All right. Have a great day, everyone.
You're welcome.